it is definitely alarming, I think, and it does contribute a lot to cardiac arrhythmias. And I think it's one of the leading arrhythmias that we're really on the lookout for because of the effect that it can have on the body if you don't catch it early enough. And then if you don't catch it early enough, it can cause significant enough disease that can prove fatal, and which is often leading to a stroke, which is either paralysis or death. So it's definitely one of the things that contributes to cardiac arrhythmias or the severity of an arrhythmia. As it relates to sudden cardiac death, I think it's a contributor, but it's not the sole reason for sudden cardiac death. Sudden cardiac death is generally a result of a variety of other potential conditions like hypertension, obesity, diabetes, other things like that, or other just anomalies or arrhythmias that are more lethal than atrial fibrillation. But if you leave atrial fibrillation unchecked, in addition to some of these other conditions, it is a contributing factor to sudden cardiac death. So we call it the MoMe ARC, and the ARC stands for Advanced Remote Cardiology. And the system is designed to do really only one thing, and it's designed to stream cardiac telemetry data, which is effectively having your heartbeats go to the cloud, from the body in near real time, all the time, that you're wearing the device. And what that does, in contrast to what has historically been done in the world of cardiac monitoring, is making the information available to clinicians as the information is hitting the cloud. The algorithms are running through that. They're giving specific alerts, through the AI to physicians to be alerted to things that they need to be alerted to. And historically, data has only been recorded on the device. It's rarely communicated, if at all. It's only communicated perhaps even once a day. And oftentimes that leads to very long delays. In some cases, if you wear a device for up to 2 weeks and it's not communicating, a lot of things could occur after the fact. You mail it in, and the doctor didn't know that there was an alert because the system never notified it. And certainly the patient may have already gone to the hospital or had some other kind of severe event. So the idea that we're sending information all the time, using artificial intelligence to prioritize that information, sift through it, do the work of the heavy lifting in terms of identifying some of these different types of arrhythmias, and then putting that information out to the caregivers, whether that's a medical technician, a nurse, or a physician, for them to, effectively remove any ambiguity about what's actually happening. And if need be, then they can call that patient directly. So it's speeding up the ability to get information to caregivers. It's speeding up the time to diagnosis. And if there's an intervention that's required, whether that's medication, go to the hospital, or some kind of invasive type of intervention like a pacemaker, defibrillator, or surgery, they can get to the intervention faster. And so, in the world of cardiology, when there's a problem, speed is always, time is of the essence. So, I think, in terms of how we do it, it's nothing dissimilar than what we see in the world of today. But I kind of liken the world of healthcare, where it's kind of been and where it's headed, is a little bit like floppy disks and fax machines versus Dropbox. We're effectively the Dropbox of remote cardiac monitoring. So we're able to utilize cloud-based technology by streaming the data off the body. We use Amazon Web Services to do that, and all of the advanced technology that they have. And we're able to scale infinitely, and we're able to run then all of our algorithms. We don't do any processing about the actual heartbeats themselves on the device that the patients are wearing. We wait and get that information in the cloud, where we use a tremendous amount of cloud power for the AI computing to do that analysis, which speeds up the ability to get to the heart of the matter, pun intended, and get that information in front of the clinicians. Well, I think the healthcare providers are key in this, obviously, because without them, the vendors, any vendor, it's kind of difficult to go forward without, physicians, utilizing the systems. But what we've done is I think we've done a great job in terms of just market penetration, but we've also formed a great collaboration with the Mayo Clinic, who's recognized as one of the leading healthcare systems in the world. They utilize our solution in all of their facilities across the US. We have collaborated with them by enabling them to start a service where they do remote cardiac monitoring for non-Mayo Clinic facilities using our device. They've invested in our company, and we've actually entered into what we call a know-how agreement, where we're able to capitalize on a lot of the expertise that they bring, both scientific and clinical, as well as advanced research that they do on AI, and be able to incorporate that into our product. So I think you know, it's probably difficult to get that level of a relationship with all healthcare providers. So, but by having strategic relationships like that with a handful substantiates our ability to go to the broader market, which is where healthcare providers will look for data, because it's a science-based market, and everybody really wants to know what does the data say, to how well does it perform, does the data prove that it works, does it say, does it have we proved that it does what we say it does? And these kinds of relationships certainly help for those that we don't have that level of relationship with, but we go, more of a vendee type of relationship where we're selling our product, where people can really trust us. And our core, our core goals is really just to be known around innovation and quality, and we've established ourselves as the gold standard in the industry for the quality aspects of ECG monitoring in remote environments.